Good evening. My name is William Giles. I go by my middle name, which is Warren. Anyway, I'm going to be giving you a brief presentation this evening on the history of emergency medical service and where we got our start, where we are today. Now, it's widely accepted that emergency medicine has got a start from the military, and in fact, there's hundreds of years ago from the military, and there's evidence of emergency medical practices dating back all the way to 1500 BC, so over 3,000 years ago. Now, most pre-hospital care has gotten its start because of the military, because of the battlefield wounded, and in fact, it continues to be a huge driver today, especially in the treatment of traumatic injuries. And those practices on the battlefield are applied today in a civilian setting for treatment of trauma in a non-austere environment. Now, like I said before, there's evidence of ancient emergency medicine being practiced. Now, one of those references that's been recorded has actually been recorded in the Bible when Jesus is given the parable of the Good Samaritan. Basically, run down on that story. There's a dude traveling on a road. He gets mugged. He gets beat up. And this Good Samaritan comes by and he bandages up the guy's wounds, the traveler's wounds, and he does this using oil and wine in his bandages. And if you kind of think about it, wine is sterile, and anything with a high enough alcohol content can be used to sterilize something. So it's kind of interesting evidence of widely accepted emergency medical practices. However, still not formal. Now, during ancient battles and medieval battlefields, carts and chariots were used to remove the dead and wounded from the battlefield, but most of the people doing the removing of the dead and wounded had no medical training. They were just simply there to clear the dead and wounded off the battlefield so fighting could continue, because blood and guts are hard to fight on, especially if you're trying to wing an axe. You lose your footing. Now, the first semblance of formalization of emergency medicine came out of the Napoleonic Wars, where Napoleon's chief surgeon noticed that he would get critically wounded patients and non-critically wounded patients at the same time, and there was no rhyme or reason to what he was getting and when he was getting it. So he developed a triage system that's still a hallmark of EMS today, where you identify the most critically wounded and you get them to a hospital first, and the less critically wounded can come later. And like I said, it continues to be utilized on the modern battlefield and in civilian emergency medical service throughout the world today. And that came, once again, from the early 1800s during the Napoleonic Wars. Now, as far as the ambulance goes, the first recorded use of the ambulance was, once again, used in a battle situation at the siege of Malaga, and that was the first recorded use of a ambulance, sole purpose to find wounded war fighters and get them off the battlefield, and that was in 1485. And it was a strict transport, and no medical interventions were provided to the warriors that were being removed from the battlefield. So it's something important to remember. And really, ambulistic treatment of patients didn't really get its start until the late 1800s and in the early 1900s, where hospitals in big cities throughout the U.S. Started training people that were operating ambulances, because ambulances began to be widely used in that time frame. In big cities. It still wasn't consistent throughout the world. I mean, if you were in, nowhere little town Iowa, good luck finding an ambulance. But in the big cities, they started to use them, and it was kind of up to local hospitals and local doctors to train certain people that were riding in these ambulances to treat emergent situations and get patients to the hospital, hopefully alive, for further life-saving interventions. But once again, it wasn't formal. There was no consistency. Those medical systems where ambulances existed were rare, and really there started to be more formalization throughout the the early 1900s, but EMS really got its big launch as we know it today in 1966 with a report called The Accidental Death and Disability, the Neglected Disease of Modern Society, and that's referred to as the white paper in EMS. And that sparked the creation of formalizations and certifications and formalized training of EMS personnel, EMTs and paramedics. And one of the big things that was noted in the report was that you had a better chance of surviving a traumatic battlefield wound in Vietnam than you did a car wreck on the interstate in the U.S. So in response to that, 2 years later, there was a task force committee of EMS that was created that developed training standards. That same year 911 was created. 3 years after that, the first training manual our textbook was published, and that would have been 1971. It was called The Emergency Care and Transport of the Sick and Injured. And that continues, that evolution in training continues to today, where a modern paramedic may be in training for up to 2 years, learning how to treat patients, learning how to recognize things, and the level of interventions that modern paramedic can perform would be unrecognizable even 40 years ago. You know, a modern paramedic has access to dozens of life-saving medications, has the ability to do a 12-lead EKG on a patient to identify cardiac rhythms and help determine whether a patient's having a heart attack or not. And it's just a huge far cry from where EMS was, you know, like I said, even 40 years ago. So kind of in conclusion, wrapping things up, EMS hasn't always been called EMS, but it's been around for a long time, and the major driver was military battlefield interventions, and continues to be a huge driver even today, especially with the treatment of traumatic patients. Today we have high-tech ambulances with all kinds of technology that can be utilized to identify things in patients that otherwise would have gone unnoticed, which allows that paramedic to make decisions to perform life-saving interventions for that patient, get into the hospital alive. You know, it's been an incredible evolution from a cart that just gets the wounded and dead off the battlefield to today with the ambulance, the modern ambulance. But it's hard to remember, and it's hard to think about a day where you couldn't pick up the phone and call 911 and get the life-saving care that you need right then. It's just hard to imagine life without it. So that kind of wraps up my presentation. Once again, my name is Warren Childs, and I will be talking to you guys later. Have a good night.